My name is Nkeletseng. I am sponsored by World Vision. My ID number is 4294. I am happy for being sponsored by World Vision.
Nkeletseng is one of the 46,000 children registered with World Vision across the area development programs, whose life and future is the focus of World Vision Lesotho. For more than 29 years, World Vision Lesotho, a Christian relief, development and advocacy organization, has dedicated itself to helping children's families and their communities to reach their full potential by tackling root causes to poverty and injustice. World Vision aspires for transforming communities where the well-being of children is realized, sustained and celebrated by communities and donors. Our strategic goal is to measurably contribute to improved and sustained well-being of 550 boys and girls, especially the most vulnerable, and quality of life of 210 households in the targeted communities by 2020. As a child-focused organization, our objective is to improve access to quality education for both boys and girls, improve health and nutritional status, and reduce the prevalence and impact of HIV and AIDS for girls and boys, improve livelihoods and resilience for vulnerable boys and girls, families and communities, strengthen local capacity for advocacy and enhanced protection and spiritual nature for boys and girls. Numerous achievements have been recorded in the areas of our operation.
I would like to thank World Vision for all the things that they did for us. Like, you have brought us some desks, chairs and tables. We are now able to write on them. Thank you, grade 5.
In the previous 3 years, a total of 72,248 boys and girls directly benefited from the establishment of libraries, school construction, school rehabilitation, supporting books, citizen voices and action campaign, and various capacity building trainings. Proportion of children currently enrolled in and attending a structured learning institution increased from 75% in 2013 to 87% in 2015. Proportion of children who dropped out of school decreased from 15% to 8.7%. Even though overall dropout rate have been declining, there is a need to address factors that attributed to school dropout, such as distance from school, the impact of HIV and AIDS, early marriages, initiation schools, and teenage pregnancies. These are cited as factors which are prioritized in the new strategy. The proportion of children who can read with comprehension remained at 50% for the last 3 years. Despite the efforts done so far, teacher-pupil ratio remains below the standard benchmark. It is against this background that the new strategy has prioritized quality of education as a key outcome. The enrollment of children in integrated early childhood care development classes is relatively low at less than 40%. Children who have undergone integrated early childhood care development not only have better learning outcomes in primary schools, but also have a much lower dropout rate. Therefore, World Vision Lesotho prioritized integrated early childhood care development and support as one of the interventions in the new strategy.
empa ho ba training ha bona ile ga fumana go bomme ke batho ba ileng le bollong na bomme ene hele spetlele re store ka ya testa batho ba ileng le bollong na bomme bana bona ha ya bollo ha fumana go bomme ga ba train ka ntle ga ba train kana go ba train ne re so ka ba le fund e re ka ba fund stipend nyana empa ile ga ha o hla fund mmuso ka ba ga ba hopola ka ntle ga bua le mentla melle mentla mella
mona mo re ga mathela makoteng ADP le ba bang ba buile mme re kopa hore na ba ka re thusa jwang molemong wa hore re kopane le sepetlele e le lekala la bophelo le ba bang ba ka amehang tabeng tseno tsa bophelo. Ya ba re etsetsa ba re thusa ka thupelo e neng e bitsitse dingaka tsa meetlo le basuwe le dikomiti tseno tse jwalo.
Mosebetsi wa ka le jana di mona sepetlele ke ho hlabolla bakudi. Ha o batla ho hlabolla wa mo hlahlobela kokwanahloko ya HIV. Ha o batla ho hlahlobela kokwanahloko ya HIV ha eba le na positive o tla tla ho hlabolle ha mo wa la o katela a mo tsisa ka mo ko mo ba itse mo ka hala le ha o tla mo ke na file tlatsa tsa fomo ya kwana ya ya mati ele o sheba sifo ya ka o tla a ni wa a nza mo mati o mo ka ka o tu size ni ka ka so ka ya.
Through their partnership with World Vision Lesotho, Madillo and Marilebuile are employed at the Maluti Adventist Hospital as lay counselors. They both have been to the initiation school. Part of their work entails HIV counseling and testing at initiation schools. In the previous 3 years, a total of 320,746 boys, girls, pregnant and lactating mothers benefited from World Vision Health Program, which included WASH, HIV and AIDS, nutrition, maternal and child health. Prevalence of stunting in children less than 5 years of age reduced from 39 to 35%. To address this challenge, World Vision Lesotho trained 266 village health workers on nutrition and monitoring of weights of children under the age of 5. Also, 1,846 pregnant and nursing mothers in 7 districts capacitated on postnatal care, integrated management of childhood illness, and nutrition education. As a continuation of the previous efforts to reduce stunting, World Vision Lesotho has prioritized nutrition interventions in the new strategy. Coverage of essential vaccines amongst children improved from 63 to 70%. Proportion of infants whose births were attended by skilled birth attendants improved from 70 to 85%. Child Health Now campaign in all the ADPs that addressed local leaders, communities and local governments on the importance of safe delivery and provided training on safe motherhood, home-based life skills to community care coalitions made a considerable contribution. Proportion of households having access to improved sanitation facility improved from 35 to 51%. Proportion of population using an improved drinking water source improved from 73% to 82%.
And as educators, we go to villages that are in the ADP and talk to the youth and children there about issues that affect them, and to youth we talk about challenges that they are facing. And as we go to the village, we don't just go to the village, we first check the challenge that they're facing and try to tackle it with them around the village. Some of the challenges that we discuss are child neglect, and some are teenage pregnancy, and we help each other understand how life can be if we stay positive.
Community members reporting gender-based violence have increased from 25% in the past 3 years to 28% this year as a result of human rights campaigns done in collaboration with churches, community care coalitions and schools. Youth with birth registration documents increased from 39% in the past 3 years to 52% in 2014 following the engagement of religious and community leaders along with relevant government ministries. The establishment of a child protection committee in each district and 3 citizen voice and action groups in 3 districts to create awareness and follow up on child protection issues is believed to play a significant role in reducing child protection incidents, frequency of gender-based violence, and has increased local level advocacy for these issues.
In 2013, we came to actually to work with World Vision. In 2013, the people of World Vision, because we had a very interesting program here of working with helping the needy and trying to hire fields from those who were vulnerable. So the World Vision actually took a very great and keen interest in our operations here. And then they made us aware that we cannot actually concentrate on crop farming only, but we must diversify our agricultural activity. So to try to look into other areas of agriculture because of climate change. As a way of combating climate change, the World Vision people encouraged us to try to start piggery. So then we were very interested in that because we were already producing a lot of maize with very limited access to market. So we saw that piggery is going actually to benefit us because we will feed the pigs with maize from our own fields.
In the area of livelihoods and food security, a total of 105,316 households benefited from the Livelihoods and Resilience Project, such as piggery, poultry, crop production, and fishery. Establishment of saving groups, developing small-scale irrigation, capacity building on conservation agriculture, introduction of improved crop seeds, as well as supporting households affected by disaster. Through our emergency relief, 91,032 people from households affected by drought in the districts of Mahalisuk, Kuting and Kachasnek received food assistance supported by World Food Programme.
When all is said and done, it is a delight to see Ngeletseng full of life, for it is our vision for every child, life in all its fullness, our prayer for every heart.